New videos every day.
I like to know things.
I'm John Breeding, and I have a request to speak a little bit to this thing that gets called Obsessive Compulsive Disorder, OCD. And right off the bat, I just want to acknowledge a pattern that you'll observe if you've been watching my videos here, and especially in terms of using these psychiatric diagnoses as a launching point to talk about human experience. First part is to acknowledge that there is this diagnosis and to remind you that it does not denote disease. It's a made-up construct without a link to any real disease. There's no physical or chemical abnormality that's been identified that constitutes this thing called obsessive compulsive disorder. Just like ADHD, just like depression, just like schizophrenia, just like bipolar, just like etc. They're all made up words to denote this thing called mental illness. Then it's assumed by the practitioners and believers in biological psychiatry that this is reflective of a biological or genetic defect. The evidence is not there for that. It's a belief system. It's an assumption. So that's first and foremost. What we're talking about is some set of behaviors that someone somewhere is judging subjectively as a disease. So let's talk about this. Obsessive compulsive disorder. 3 words. Obsessive, compulsive. Sounds like clinical psychiatric symptomatology, right? And it's a shame that words like obsessive and compulsive and depression and attention, get co-opted and compromised and corrupted and perverted into psychiatric symptoms so that their original usage is lost. But in this case, just think about the word obsessive, right? What if we called it single-minded? What if we called it purposeful? What if we called it meticulous? What about compulsive? What if we called it detailed? What if we called it committed, determined, persistent? See, these are admirable traits. Yet obsessive compulsive is like a pejorative put down, and in this context, it's called a disease. Language is power. This has been taught for a long time. Michel Foucault was one of the guys who kind of figured this out. And Thomas Zaatz said, psychiatric diagnoses are not descriptive. They don't describe reality. They prescribe a course of action. They're not descriptive, they're prescriptive. They prescribe a course of action which puts an individual under the control and dominion of those who label them. And in this case, the course of action is diagnosis, means treatment, means drugs. And the treatment of next resort is electroshock. Disorder, of course, is a euphemism for disease, illness. So obsessive compulsive disorder means psychiatric disease, means biological or genetic defect, means you are not capable of being responsible for your life, which means we need to take control of your life and assure that you take these psychiatric drugs and get under control. It's a prescription. Okay, so that's called deconstructing the language and the practice. Now let's use this as an opportunity to just share a few teachings about what might be the psychology behind this. Again, there's always physical dynamics that need to be looked at. Right? But let's look at a few psychological dynamics here. James Hillman is a pretty famous psychologist. He's written a lot of books. One of them is called The Soul's Code. In that book, he says that there's 3 aspects or 3 things you can do to enhance or facilitate a child's imagination. And I like this, so I've remembered this. The first is have a parental fantasy about your child. Fantasize about your child. Use the imagination. Share your fantasy. We think, oh, don't do this because it might lead the child down the pathway. But actually, it's a pretty good thing to do it out loud, and especially if you can be kind of lighthearted about it. Because if nothing else, it helps a child realize that that's not what they want to do. The problem, of course, is if you don't fantasize, but you determine a reality that my child is going to be a doctor because all breedings are doctors. That causes problems. Okay, here's the second one. And this is the one that I really like, and this is the one that's directly relevant for this so-called obsessive compulsive disorder. He says you can really help a child's imagination by being generous with the child's obsessions. Generous with the child's obsessions. I love that. It's so different than, oh, fearful and worried about the child's obsessions and calling that a disease and labeling them with a psychiatric label and then sending them down the road of drugs. Right? Fear, worry, drugs. Generous with the child's obsessions, it means relax. Trust and support the places that they get intensely involved with. Because that may be a window to the child's soul. That may be an indicator of what they were born to do. The teaching is everybody's born with a purpose, with certain gifts that they brought into the world to share and serve, and the adults and elders' job is to watch the child and do their best to support and facilitate and enable the development of those gifts, because otherwise the community loses something precious. So instead of being fearful, trust your child's obsessions. Caveat would be take into consideration a place where reality is perverted by our society, such as, feeding addictive sugar and foods like that and then getting obsessed with those. That's obviously out of balance, right? Or getting obsessed with having to watch television all the time. That's obviously out of balance. But something that flows from the child is their interest. Be generous with the child's obsession. Relax about it. The last one, I just love it. He says, have a generous assortment of odd fellows and peculiar ladies in the perimeter of the child's life. See? Instead of being fearful and worried about protecting the child from weird people and perverts, you have a generous assortment of odd fellows and peculiar ladies in the perimeter of the child's life. That stimulates the imagination. That makes life rich and interesting. Food for thought, right? Maybe some of these odd fellows and peculiar ladies might otherwise be labeled obsessive compulsive disorder. Anyway, I like that idea. Relax and see your child's interests and support them in their interests. A couple of other concepts related is one of presumed intellect. Don't focus and worry on what you construe as weird. Assume that there's an intelligence in the child and that their interests are important. And don't obsess. See, I can use that word too. Don't obsess, worry, get frantic about their focus. Look for their abilities and be aware of their abilities and allow those to expand. Support those, resource those. Got the idea? Now that said, and given that a lot of times, just like with any of these psychiatric labels, the label is really just reflective of fear and worry and misinformation in the people around the individual who are making the diagnosis. It's like I say about ADHD, it's funny disease. A lot of times the symptoms of distress reside more in the people around the patient than in the patient.